thank you for encouraging me so much to have the
Oh,
surgery.
it's my pleasure. I just am so delightful to see you. And I don't know if I've ever seen you smile.
You have not. We were on the phone before. You haven't seen me, no. and so and so this is a little on the different side. I've got my soft collar now instead of my hard collar.
Yeah.
And
So bring me up to speed. It's been a few months. Last time we talked, you were really, really struggling. The neck was a disaster. The pain was everywhere. It really seemed like things were just moving downhill. Can you tell me about it? Go back to that time right after we
well,
talked, and what happened? Bring me up to speed.
uh, the my surgeon, who had been the surgeon that doesn't do surgery unless he absolutely needs to, was what I'd been told before. Had said he'd have to do 3 fusions. It would be dangerous, but go to physical therapy and go to the pain center. Physical therapy was talking about me needing mental health because I was having bad pain, and and the pain center was suggesting putting this device in me that would have been injecting morphine and baclofen into my spine,
Wow.
and I was
Like
like,
mainstreaming morphine and baclofen into the fluid around your brain
yeah.
instead of fixing the problem.
And so I was uh, I knew I had something wrong, and then they suggested I see his partner. Well, I called to make an appointment, and they said we don't do that, and that he had said to go back to my regular doctor if I still had problems. Totally had dismissed me.
Yeah.
So that had left me thinking, well, maybe I just need to forget it all, you know? And I had been watching you on YouTube, and I thought, okay, I'll call and consult him just to see, just to get somebody completely outside of the state and see what you said. And the way I was reading the written report, it looked like there was quite a bit there. And you confirmed that for me. And so when I went to the second opinion, uh, he said, yeah, this is big. Same word you used. and and then I put him off because all of my goats were delivering babies.
Oh, I forgot about the about the goats.
Yeah, I
Yeah.
had 43 kids born this year.
No kidding me. That's
So
amazing.
in that condition, I was out there working in the barn. And once I got all of my bottle babies off bottles, I went back to him in July, and he come in and he said, you know, we reviewed this and this is really big. And my symptoms were getting worse. I mean, I was barely using my hands. My hands will do whatever I want them to now, immediately after the surgery. But he said it would be a 4-hour surgery, and he had to do 4 fusions. And he told me there were a lot of bone spurs in there. That it was bad.
Yeah. Wow. Okay, let's take a look. You sent me the x-ray of the hardware that you got in there. Can we take a
Yeah.
look at it? All right, let me show that. Might take me a second to get that up. But I can do it. Maybe.
I wish I had the MRI, but I don't have a computer to where uh, I could give that to you.
Oh, the MRI after, or you mean before?
Before, yeah.
Yeah. No, I think I had that, right?
I
Yeah.
had given you the report,
Oh, that's right. I
but
had the
not the
report.
actual
Yeah.
MRI. Yeah.
Yeah. Yeah. Yeah. Man. Um, give me 1 second. And here it is. Yeah, let me show this to you so we can take a look at it together. Now, this is an X-ray from the front of the neck. And
Uh-huh.
so this is the base of your skull. And we can barely see the bones of the spine in the background, but they're right here along the middle. And the 800-pound gorilla in the room is this thing. It looks so big and it really isn't. These plates are about as thick as a dime or maybe a nickel. And what we see from the front is the plate. Everywhere there's one of these holes is where there's your normal disc space and there's a spacer in there. So there's 1, 2, 3, 4 holes with 4 spacers.
And he had to
And
put he had to set an extra plate, he said, to hold it all
yeah,
because
this looks like
pretty
the old
bad.
plate. The fourth, this is the original right here. And then here's
Yeah.
all the new stuff. And then we can see these vertical lines. These are actually what they call fiducials. These are markers that are inside the implants, which are now taking the place of your disc. And then anchoring this down like a, like a drywall anchor are screws that go into the bone. Here's 2 of them here. Here's another 2. Here's another 2. Gosh, this looks like great work and great surgeon. He really did a superb job in getting this in position and anchoring it down and especially when you consider the prior surgery. So awesome situation you're in right now.
He did a fantastic job, I feel like.
What was it like having surgery? Was it painful, not painful, swallowing? What did it feel
Uh,
like having that ACDF?
Actually, I had friends that had told me about having had major swallowing issues, like needing a feeding tube for a week afterwards. So I was frightened.
Mm,
My daughter bought me slushies
hmm
and I swallowed those right down, no brain freeze. They were, but they cooled that all down and iced it all down, and my swelling went down fast.
hmm
So that was a smart move. And I've been telling other people, tell your patients to use slushies.
How about goat milk?
Goat milk probably wouldn't have been cold enough at the time, but I've not had any swallowing issues,
Oh, he must have been
and
very gentle.
uh,
Good.
I'm still having just a little pain.
Mm.
But this was quite a bit of surgery.
Yeah. I mean, this is the surgery, no matter how gentle, no matter how well done, this was quite a bit of surgery. So how about in the arms? How do they feel?
They are so much better, and my hands. That was the first thing I woke up, and this left hand. Now I feel just a tiny tingle in my left finger,
Mm.
but it's not anything compared to what it was. It,
Yeah, and
it
that's not where they operated. So that's just your neck getting used to everything that's going on in there now.
yeah, there's some muscles tension, but he pulled my neck into a different position, so I guess my muscles are saying no, we don't like this.
Sometimes people feel a pain between their scapula as the new,
That's basically, yeah, a
yeah,
little in there.
yeah, that's normal and that always goes away. It's just, it's hard to put an end date, an expiration date on that pain, but it's gonna go away. So the typical ACDF issues, you're a very typical patient from that point of view. Not too much pain, but definitely some. About a third of people get swallowing problems that are significant, but the vast majority are like you. They really don't have any problem at all. Your friend who had the feeding tube, that's like less than 1 in 100. That's very unusual. Of course, that's what everybody worries about. And then
Yeah,
also, most people do wake up feeling like their hands are back and part of their body and they can
that's
move again. And
yeah, that's the good part.
yeah, that is the good part.
That's the amazing part. And so I'm so thankful I had this surgery.
Yeah, me too. All right, so what's next?
What's next?
Yeah, when are you going to get that collar off?
um, Probably about another week. I'll start weaning myself off of it. I'm not sure how long on the bone stimulator though. That's I use it 4 hours a day.
Yeah, I mean, one way a doctor might manage that, your doctor will have his own approach, but one way is to get a follow-up x-ray, and when you can see that things are fused in there, get rid of the bone stimulator. You know,
Yeah,
use it until it's gone. A lot of doctors would not recommend those soft collars. Some do, some don't. That plate is so strong in there, I just doubt it's gonna do anything. But you always want to follow the advice of your doctor, because just like every patient is different, every doctor is different. And you want to do what one doctor has discovered what works for them. That's what you want to do if they're your doctor.
that's what I'm trying to do everything like he said, and he'll follow up with X-rays in October.
I
And
feel like
so
you'd be a hard one to keep down with all your goats and your farm and all the rest.
I've been doing physical and occupational therapy, so I'm trying
Okay.
to get stronger, and yeah, I'm
You
going to
definitely have
get back out of this.
you definitely have a window in which your nerves were so compressed and now they're so normal that you can kind of reconnect, and don't let that window go unused. Get everything you can and don't let yourself backslide. Once you get through all this, keep going strong, Sandra Bagwell.
Thank
You're gonna
you.
need it.
I appreciate it. Thank you.
Well, it's just been delightful talking to you. You made my day. I was worried about you when we talked before. I could tell you were a trooper, but gosh, the pain pumps and the stimulators and the drugs and that stuff
There
doesn't
were
work.
so many, it was so many different recommendations, and I really didn't want surgery.
I know you didn't, but when the problem can be fixed, it has to be done. And so I really, really salute you for your bravery and going through with what everybody knew going in was going to be a big surgery. And you did the right thing by getting a second opinion and finding the right surgeon and sticking with it. I don't know if I agree with waiting until those goats were weaned.
I'd like to encourage other people just to go ahead and get it done.
Yeah. But you know, everybody's got to eat, even the goats. So good for you. You're a good person. All right, young lady. Well, you have a great weekend and thank you very much for calling back.
Okay, thank you. Bye.
Bye now.